Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about wearables today. A lot of my patients are coming in lately with an Oura Ring, a Whoop Band, an Apple Watch, glucose monitors, and all of that wearable tech has positives and negatives. I'm seeing it more and more. I wanted to briefly discuss some of those kinds of wearables, what we can learn from them, what's good about them, what's bad about them. So to start with, the wearables of the Oura Ring, the Whoop Band, the Apple Watch can measure two very specific things that are really interesting for anxiety and depression. So the first thing is they can do sleep stages. The 8 sleep mattress can also do this. But sleep stages are basically the amount of time you spend in each of the stages of sleep. So how much time and what percentage of your sleep you're spending in REM, what percentage of your sleep you're spending in deep, light sleep, how many awakenings overnight. The Oura Ring can even do some oxygen monitoring to tell you how many times you desaturate or have low oxygen levels overnight. So there are some really interesting data that you can pull from this. I'm going to have another video on sleep later, but sleep is so important for mood and mental health. So being able to track that, being able to iterate different variables to see what effect they have on your different sleep parameters can be really, really empowering and informative. So I love the sleep tracking. The other thing that those wearables allow people to do is heart rate variability. Heart rate variability is a nifty little measure of the variability between the heart rates. So you might say, well, I have a heart rate of 60 beats per minute, but that isn't one beat every second necessarily. It's one beat every second and a half, every half second, but overall your heart rate is 60 beats per minute. But the amount of variability between the spacing of those heartbeats is actually the higher that variability, the better rested, recuperated, ready for stressors a person is. So when that variability becomes very low, when a person's heart rate really is very incredibly steady, that actually means that the person is under stress, about to get ill, didn't sleep well, is on drugs or other medications that decrease that responsiveness to environment and stressors. So heart rate variability can be a really great thing to track. And a lot of people will use that and watch heart rate variability and optimize their sleep to increase their heart rate variability. They'll optimize exercise to increase heart rate variability because the measure of heart rate variability really tells us how we're responding to stressors and how healthy our body is. And so that's something else you can both iterate variables and kind of adjust to find things that specific to you make your overall system healthier. I've seen people do games with heart rate variability and with sleep stages to kind of track each other's, share and have accountability, play games like, who can lose the most weight in an office, but instead it's who can, increase their heart rate variability the most. So there's lots of ways to kind of gamify it and make it more interesting, more challenging, rather than just having a number and feeling very disempowered that you're not able to change anything about that number. You can literally see on a day-by-day basis that things that you do affect the heart rate variability or affect the sleep stages. So one of the newest wearables that I'm seeing more and more commonly now that the FDA approved kind of an over-the-counter consumer version, as opposed to only prescription versions, is the blood glucose monitor. And this is getting a lot of press right now because the doctor that is up for Surgeon General is very, very pro consumer blood glucose monitors. So I wanted to talk a little bit about these as well. There are multiple versions of blood glucose monitors that you can buy over the counter, and you install an app on your phone, and the device sits in your upper arm, usually with a very, very tiny, the thinnest gauge imaginable needle, 30 gauge needle. Most people don't even feel it once it's in place, and it's a very, very short needle. It samples continuously the sort of interstitial or in between tissues fluid of the fatty area of the upper arm. And it gives you an instantaneous readout to an app on your phone. This allows patients to be able to kind of tell what they're eating, and it's instant results on blood glucose. And the reason for mood and mental health that I find this so attractive is because we used to think that people only experienced mood changes and mental health changes when their blood sugars were very, very low, in the dangerous range, under 60 or under 50. And when they were very, very high, above 200, 250, we know that those blood sugars have very serious mood effects. But I think most doctors kind of assumed that as long as you were within the 60 to 200-ish range, you probably felt fine and your blood sugars didn't affect your mood. But what we're finding now that more and more people are wearing these is that blood sugars outside of a very tight range, so around 80 to 120, can have effects on the mood. And so if you're much below 80, you can have some anxiety, you can have some restlessness, irritability. If you're above 120 to 130, you can have irritability, restlessness, you can have some difficulty sleeping. So there are mood effects outside of the very tightly controlled normal blood sugar range. And I love the wearable because it really gives you instant feedback on what you're eating, so you can make better choices and have power to make those changes. So it's very empowering and allows people individually to see what affects them, because even if you're following the American Diabetes Association diet, every person's biome, gut flora, stomach emptying time, they're all different. And so the way we interact with food is going to be very different from another person who has a different gut biome and stomach emptying time, stomach acidity levels. So it really allows us to individualize our diets for our own health. And so those are the great things about heart rate variability, sleep measurements, and blood glucose measurements. The downsides are really when people get so obsessed with perfecting those things. So I have seen some people be very, very worried about an individual number and sort of perfecting each individual measurement at the expense of other markers of mental health. So it's great to overall prioritize sleep and make sure that you're getting good sleep. But if there is a social event where you're going to see lots of people and have lots of friends and, really enjoy yourself at the social event, it's much more important to go to the social event than it is to, on one night, prioritize sleep. So I very much want patients to still have balance when it comes to, what they're prioritizing. Sleep isn't always the most important. Sometimes family, relationships, social events can take priority. Similarly, with the blood glucose, you can eat that piece of birthday cake. It's not about the one piece of birthday cake at your 85-year-old mother's birthday. It's about blood glucose overall. So it really is about, keeping balance in life. But having these measurements empowers us as patients to really take control back over our sleep, figure out what variables we need to change over heart rate variability and stress, and over blood glucose. So just my little push for the wearables that I'm seeing and how we can use them ourselves as patients to optimize our health. I recommend playing with the idea of having a wearable for a month to 3 months, whether it's a glucose monitor or a wearable for heart rate variability and sleep measures, and then using that data on a day-to-day basis to iterate changes and see what affects you personally. Probably don't need more than about 3 to 6 months with any of those wearables, but it can be really helpful for taking control back over the variables that affect your health.